Hey everybody, just doing a quick video about contact lenses for astigmatism. These are also known as toric lenses. And I still hear people tell me once in a while, like, oh, I can't wear contacts because I have astigmatism. They were probably told this years ago, back when they were first coming out with these kind of lenses, and they didn't work as well. So in order for these lenses to work, they have to rotate, so everybody has an angle to their astigmatism like this, and then the contacts have to kind of spin to match up with that. And if they kind of go out of alignment, a little this way or a little that way, it kind of makes the vision inconsistent. But nowadays, though, these kind of contacts usually work pretty well for most people. I mean, they're a little bit more involved to fit sometimes, but more often than not, they just work. I try to set people's expectations with these kind of lenses. If you're expecting as crisp a vision as you're going to get with glasses, you're probably not going to get it. I mean, this still should be good vision, but the reason for that mostly is that there's about 1 million different combinations of powers with you have an astigmatism power and your nearsightedness or farsightedness power and the angle, and so these companies can't make every possible combination, but usually we can get something that's pretty dang close, so if you have like kind of a lower amount of astigmatism or a medium amount, like usually we can get that to work pretty well for most people. If you have a higher amount, sometimes that gets a little trickier. They make what are called extended parameters lenses that we can try out, although the vision tends to be less consistent with those, just because if it even spins just a little bit, it can throw things off, like when you blink, for instance. Or some people, are better candidates for, using like a rigid gas permeable lens or a scleral lens, something that's harder that kind of covers up the surface of the eye. And those are less comfortable, but sometimes a better option for people with really high amounts. But yeah, that's stuff that obviously you can always discuss with your optometrist if you're curious. Thanks.